Hello, everybody. This is Dr. William Song, and I am going to talk about our SCEFI fat transfer. SCEFI, SCEFI, stands for Stem Cell Enhanced Fat Induction. This is my unique technique of doing facial fat transfers. So I know we've been getting a lot of questions about fat transfers because people have become tired of getting fillers. Fillers are great, but the problem is they don't last and they could migrate over time. So people are looking for a natural alternative, and they're looking for an alternative that lasts. Now, the reason why the facial fat transfer has become a big topic of conversation lately, especially on social media, is because now there are two products that are available where you can get off the shelf fat products. These are fat cells that have been sterilized. They're harvested from cadavers and they're sterilized so that we can inject it like a filler. And these fat cells are not living, but they can cause your body to create new fat cells and enhance the fat cells that are already in your body. So, why? My question is, why would you use cadaver fat if you can use your own fat? Why isn't everybody doing fat transfers, and why are they using these cadaver fat, which are very expensive and it's somebody else's fat? So the real easy answer is because there is a little bit of expertise involved in harvesting the fat and processing it and transferring the fat. So now I've been doing fat transfers for almost 15 years now. So we've been able to tweak the procedure that we've been doing. And over the years, I've discovered ways to really get the most out of the fat transfer and make it last. The problem with fat transfers, especially if you go on the internet and look up fat transfer, is that most people feel that the fat doesn't last or all of it doesn't last. So the myth is that if you do a fat transfer, you're going to lose half of it. So some people will put twice as much fat in so that when half of it goes away, you'll be left with the half that you want. Now, this is a terrible idea because it's not going to be precise. And sometimes when you overfill like that, the fat doesn't go away and all of it stays. That's when you see the disasters. If you go on the internet and look up fat transfer, you may see some pictures of fat transfers gone wrong. And this happens when doctors overfill, anticipating that half of it's going to go away. But if it doesn't, then you're in trouble. And so, why does the fat not stay? Why does half of it go away? Well, the reason is because if you overfill, these are living cells. So, if you put too much fat into the area where you want to transplant it to, those cells are going to be competing with each other. They're not going to get the nutrients they need to survive. So overfilling is a terrible idea. What we want to do is we want to process the fat in a way that we can get all the cells to survive so that when we do the procedure, we're putting exactly the amount that we want. And then we're going to try to get them to all get their own blood supply so they can keep regenerating and survive for the rest of your life. And this is where my SCEFI technique comes in. What I've been able to do is we take extra fat because the fat is a rich source of stem cells. So what I'll do is I'll extract extra stem cells from the fat and enhance the fat that we are going to be injecting into you. So that's the unique part of the SCEFI fat transplant. So the process involves doing a little mini liposuction. We'll numb the area and we'll very gently harvest the fat from a different area in your body. And people always ask, well, can you just take more? Yeah, we can, because we do liposuction as well. And a fat transfer is a perfect addition to a liposuction session since we're taking your fat anyway. But we can also do the fat transplant independently in which case we don't have to take a lot of fat. So we just need a little bit. Usually we take about 60 cc's of fat. And of that, after we process it, we end up with about 20 cc's of fat cells that we're going to transplant back into your face. And when we transplant it, we process it so the fat cells are broken up. Because the other thing about doing fat transfer is that if you put big clumps of fat, the center of that fat lobule is not going to get the nutrients. So we want to break the fat up gently without destroying the cells so that each individual cell gets its own blood supply. And that's how we get it to survive. That's how we avoid lumps. And that's how we can get delicate areas like under the eyes. We can fill your temples. We can fill your cheeks. We can fill around the mouth and your jawline. So we do a comprehensive rejuvenation of your facial fat. And what we're doing is we're not just indiscriminately putting fat in your face. We're targeting the fat compartments that are naturally present in your face. So there are many different compartments, and we're going to target each one of those so that it looks very natural. And then what happens to the fat after we put it in? Well, the fat cells are living tissue, so they're not going to live forever. They go through a life cycle, and once they go through their life cycle, the fat cells die off, and then they're replaced by new cells. And they're going to be replaced in the same place where we place the fat cells. So what we're doing with the fat transfer is we're actually marking out the areas where we want your fat cells to keep regenerating for the rest of your life. So when we do a fat transfer, usually after about 2-3 months, you'll see a deflation, and that's normal because the fat cells that we implanted have gone through their life cycle, and then they're going to get replaced by brand new fat cells. And as that occurs, it's going to look very natural, and it's also going to induce stem cells in the area. So the skin actually looks better, and you're really getting younger skin that regenerates on your face. That's why we have patients that are 10 years out and they look better than they did when they originally had the fat transplant. And the nice thing about the fat transplant is that we can always top it off because you are going to age. Even though the fat is going to keep regenerating for the rest of your life, you're getting older. So we can keep up with the aging process over the years by doing little touch-up fat transfers so that we can keep you looking very natural and without overfilling. And the fat is going to help your skin. So that's our motto, age backwards. And this is our SCEFI fat transfer procedures. So that's how we do it. And now I'm just going to open it up to any questions that we may have. So Fiona, are there any questions that have come in?
So we have a couple here, and you touched upon this, but main question that people ask is where does the fat come from? So where can we take it from when we're doing the fat?
So we typically take the fat from the abdomen or the flanks, but we can basically take it from anywhere. We can take it from the hips, we can take it from your thighs, we can even take it from your arms. And when we harvest the fat, we don't want to give you divots, which sometimes I've seen happen when people harvest fat. And because we do liposuction, we pay very particular attention to making the harvested area look good too. So if we harvest from your abdomen, we'll actually get a little reduction, and we wanted to make it symmetrical so that the area that we harvested it from will actually look better too. But as I mentioned before, we can do a full liposuction if that's what you're looking for.
Awesome. So now that it's summertime, a lot of people don't really want to wash down. Is the recovery process long? How much swelling and bruising should they expect?
So if we're harvesting for a fat transfer to the face, again, we don't need to take a lot of fat. So the area that we harvested from may be a little bit sore, but there's not a lot of downtime from where we harvest it. And usually we just put a little bandage to pick up any for any kind of fluid leaking out, but that usually stops within a day. So people are more usually concerned about their face, what it's going to look like after the procedure. So with this treatment, you will get some swelling, but it's not crazy swelling. And most people don't bruise, but some people can. So we want to make sure you're prepared for the possibility that you may bruise. And sometimes, especially if you're older or if you're on any kind of blood thinners, you can get some more significant bruising, like a black eye. If that happens, that can last for weeks. But a typical fat transfer might get little tiny bruises that go away within a week, and the swelling usually goes away within 1 to 2 weeks. So after a week, you'll look pretty normal. After about 2 weeks, won't look like you had a procedure done, but you don't need to hide out, and you don't actually need to avoid the sun with this procedure because it's done underneath. But of course, we're going to tell you to avoid the sun just in general because sun is going to age you, and you don't want to undo all the great effects of the fat transfer.
So, of course, the main thing that we're looking to address with the fat transfer is restoring volume. But what other benefits can patients expect when they do a fat transfer? I know you touched upon the skin quality improving.
Yeah, what I really love about the fat transfer is that in addition to being able to strategically replenish your natural fat pads, the stem cell boost that we get from a fat transfer will help with pigmentation, it'll help with the skin quality in general. It's going to even soften some wrinkling, and some people actually feel a sense of well-being after the fat transfer because they get the extra stem cell boost. So the fat transfer is going to be a very natural process. And compared to fillers, collagen stimulators, and treatments like that, this is a very natural process. So you're unlikely to get any kind of fibrosis that you can get with some of the other treatments.
Okay, yeah, that was actually kind of going into my next question. Sculpture has been around for a while, but it's become a new buzz on TikTok and Instagram. So, when would someone choose a fat transfer over sculpture, or what's your take on sculpture and collagen stimulating?
So we do use collagen stimulators. We use fillers all the time. But the fat transfer really is the ultimate treatment. The advantage of doing a filler is that you'll get instant results, and it's easy. It doesn't take long. There's no harvesting involved. And then with the collagen stimulators, it does take time to stimulate your own collagen. But the way they work, the way a product like Sculpture works, is that it actually creates a little irritation in the area that we injected. So that irritation sends a signal for your body to produce collagen around it. So that's how the collagen stimulators work. With the fat, we're actually sending the natural signal that your body produces from the fat cells. So in addition to replacing some of those fat cells that have you've lost over the years, you're continuing to send the signal to produce collagen. So in answer to the question, if you want a quick little touch up here and there, collagen stimulators are great. But if you want to do a more significant, long lasting treatment, fat transfer is really the way to go.
Just another question. We offer auto tour here. When would someone choose auto tour versus a fat transfer?
So autocore is our PRP treatment where we take the plasma from your blood, extract the platelets, and then use the signaling from the platelets to help stimulate collagen. And with that treatment, we can combine it with fillers, and we can even make a gel out of your plasma to get instant volume. Now, this is nice because it's all natural. It's well, a little bit of filler, but it's possible that we can do it without fillers and make it all natural. So there are a lot of little things that we can do with the autocore. The autocore treatment is a great way to maintain after you do a fat transfer because it does not involve a harvest of anything other than your blood. And it's also great for as an alternative to fillers if you're trying to get little areas and you want it's a little more temporary. You do have to maintain it. So we in your consultation we can decide if an autocore treatment or the fat transfer would be the best for you. Where the autocore treatment really shines is under the eyes because we don't like to put fillers under the eyes because you can have a lot of complications with fillers and it's hard to get it to look natural. So for under eyes, my go-to is either the fat transfer or the autocore treatment. If you're just concerned about the under eyes, sometimes you don't want to go through a fat harvest. So that's where the autocore is going to really come in. And the autocore, we can also get really superficial with it. So the autocore HD is a process where we can target those lines that form around the mouth, like the smoker's line and those lines around the like the marionette lines. Those are harder to get with fat because we don't want to put extra volume in that area because you don't want too much fullness there. So we can use the autocore treatment so that we can target those lines without putting volume in.
Okay. And last question I just want to throw in because people always ask is can you do fat transfer to the lips?
So the fat transfer, unfortunately, have not found that it stays in the lips, and there's probably two reasons. One, the lip is an area where you don't naturally have fat. Okay, it's mostly like collagen and vascular tissue. So by putting fat there, you can get some temporary fullness in the lips, but it just doesn't last in the lips. So if you're trying to enhance your lips, that's where I still use fillers because we can get the fillers with some of the techniques that we have, we can get the fillers to last a lot longer than other people do. But the fat transfer is not the ideal treatment for the lips. Although, if you're doing a facial fat transfer, sometimes I will put fat in the lips. Just you have to understand that's going to go away in your lips.
Perfect. And so if someone's noticing volume loss and some signs of aging and they're looking for more long lasting solution, what should their next step be?
So, well, we always encourage you to come in and do a consultation. We can do consultations by Zoom because we like to tailor these treatments to your individual needs. So it's hard for me to tell you in general that this is the best treatment, that's the best treatment. But when we take a look at you, then we can give you recommendations of what would be the best for you because the fat transfer is a great treatment but it may not be for you. You might be able you might just need something simpler, or you might need other treatments that are energy based. So we can talk about all the things that we have available. So, yeah. So we'd love to hear from you. If you want to schedule a consultation, give us a call 201-368-3800. And anybody in my staff can tell you all about everything we do. And I'd be happy to have a personal consultation with you as well.
Thank you, Dr. Song.
Thank you.